Good evening, and thank you for your time and your attention. My name is Monica Christian. I am a speech-language pathologist with the Center for Therapy and Rehabilitation at Pascack Valley Medical Center. Tonight we'll be discussing your child's communication, understanding speech, language, developmental milestones. So just to begin, as I mentioned, I am a speech-language pathologist with the Center for Therapy and Rehab here at Pascack Valley Medical Center. I, along with my colleagues Danielle Falsiglia and Julia Agosto, make up the speech-language team, providing services across the lifespan to basically children up through adults, both on the inpatient and outpatient wings of the hospital. I also wanted to take the time to especially thank Shannon, who helped with coordinating this talk today. So over the course of the next few minutes, we are going to have a discussion regarding what is considered to be typical speech-language development, focusing primarily on children birth up through the ages of 5 years. In the state of New Jersey, it is required for children to enter into kindergarten, or at least to start with kindergarten. So at that point, you will have additional eyes and ears available to you as a parent and as resources. So I decided to focus more so on birth to 5 years of age. We're going to talk a little bit about some strategies to help support this development, things that you can do along the way to really allow for maximizing speech-language development. And then also, discussing what could potentially be red flags of concern, areas that may warrant seeing or alerting your physician. And then we have some resources as well. So just starting with birth to the first year of life, the way that I broke these things down, we're talking from a perspective of hearing, understanding, and speaking. So when we're looking at speech, just as a definition, speech speaks specifically to how we are actually using what we call our articulators, which are your tongue, your teeth, your lips, your cheeks, and coordinating that with your respiratory system in order to be able to produce sounds and putting those sounds together in order to produce a word and then ultimately sentences and conversation. So speech is more of the mechanics. Language is our ability to understand what's being said to us, and also our ability to put those words and thoughts together to express an idea or to comment. So when we're speaking specifically of talking, we're looking at speech sound production and also expressive language, so our ability to put those words and thoughts together. Hearing and understanding is our ability to interpret what's being said to us. So when we're looking at children birth to 1 year, I broke it down into 6-month chunks because there's a lot that happens within that first year. As a parent, you're going to be seeing a child change constantly, every day. It's amazing how they acquire language and start to respond to their environment. So within the first 6 months, especially with hearing and understanding, you're definitely going to be seeing the child is going to startle to different sounds that they hear. They're going to be very aware of what's going on in their environment. We're hoping that they're also localizing to sounds or looking from where sound is actually coming from. They'll begin to understand your voice and be responsive to different voices. So making a distinction between mom's voice versus dad's voice and changes in tone. So when you're happy and excited, they're happy and excited too. They may even imitate some of the productions that you're making. They're also going to be tracking. So they're going to be looking across the room. So it's that age where they're starting to take in their environment, engage in their environment, and they don't have the language yet, so they're actively using their senses to tune in. What you'll also start to notice is that baby's going to be, making their own little sounds. They're going to be cooing. They're going to be babbling. By the end of the 6 months, you'll probably start to notice that these sounds will be more speech-like. The child will giggle, they'll laugh. They definitely have a distinctive difference in when they're happy and when they're upset. So as a parent, you probably know the different types of cries, when they're angry versus when they're wet versus when they're hungry. But by the end of that first year, what you'll start to notice is that there's going to be joint attention that's established. So baby's going to be looking to where you're pointing. They're going to start localizing specifically to where your voice is. If you are calling their name, they're going to respond to that. They may give you a nice little happy cooing sound, or at least establish eye contact. They're going to understand some very simple words. No is a big one. Come here, want more. And as a parent, you may also start to notice that you're using gestures to communicate more effectively with them. They like playing games. They like hearing silly songs, listening to short stories. So paired with that, the babbling is going to become a little bit more complicated, complex. They're going to start using those sounds to actually get your attention, to maintain that attention. They're going to start pointing and using simple gestures. So more than likely, if you use your arms above your head or raise your arms above your head to indicate, that you want to pick the child up, or you're asking if the child wants to be picked up, that may be a big one. Saying hi, bye. They may have a lot of those gestures and may even have some sounds paired with that as well. They're going to have a couple of words at this point, but we're not going to expect, of course, for those things to be perfectly clear, but they are starting to make the connection between the sounds that they hear, that they can actually have some level of meaning. They're getting a response from them. In addition to that, when we're looking at where these kiddos are by the end of that first year, socially, they're much more aware, as I said, of their caregivers. They're taking the time to explore your face. They're trying to establish connections with people that they know. They're showing us that they're learning because they're exploring new objects and toys in different ways. They have interest in experiencing new things. They're very curious, and they're actually starting to imitate, which is a good sign of learning. They're very clued into what you're doing. Physically, what we may see is that they're starting to hold on to objects. They're able to hold objects in each hand. They're able to point. They're able to clap, hold on to foods, bring their hands usually to their mouth. They're sitting up. They're starting to crawl. At the end of this particular year of development, there's a lot of cruising going on. And for some children, they're actually starting to walk independently. As we move on to the next year of development, from a receptive standpoint, you're going to start to notice that things are a little bit more specific. So the child will be able to identify different body parts. They're starting to follow, one-step simple directions very, very consistently. So if you ask them to do something, you may start to notice that you don't necessarily need to give them a gesture to have them follow through with what you're asking. They're going to start responding to very simple questions, really enjoying and sitting down and attending to short stories. You may also see that when you're reading that story that they're pointing to objects in the book, and you can give them different words. So from an expressive standpoint, can give them a different word, and they may repeat what you say, and they may be able to also identify what you're showing them in the picture book. Expressively, they've got lots of new sounds that they're playing around with. They should consistently have some of those earlier sounds, that p, p, and w at the beginning and ends of words. You'll start to hear those much more consistently. And they're going to be asking simple questions, lots of WH questions, the what's and the where's. And if you notice, as a parent, you may also be asking the children these questions, which is where they're learning how to use those effectively. They're going to start by the end of this year to definitely be putting a couple words together in a very short phrase. So more apple, mommy book, want up. So you'll notice that the content usually is some sort of agent who can execute the action. It's all about getting that immediate need and fulfilling that immediate need and want. So from a social perspective, children in this particular age group are definitely much more aware of other children. So they're starting to kind of broaden their circle of who they see and who they're willing to engage with. So it's not just engaging with mommy and daddy. They're probably also engaging with siblings, you know, other children that they may see at the park. They're imitating what those children are doing. They're not quite yet ready to start sharing, but they're looking to explore how to play with these things in new and different ways. So when we're looking at their cognitive development, they're hoping that you as a parent can also explain to them, show them, explain things to them, have them understand what they're engaging in when they're reading through books. They're going to take a lot more initiative, attempt to be much more independent. You may start to see that they're putting together very simple puzzles, block puzzles, using shape sorters, being able to start identifying things that are the same. And physically, they're definitely walking. They're super busy, crawling up the stairs. They're pushing different wheeled toys, pretty effective with that. They may be able to throw a ball for a short distance. They're starting to stack blocks up. And we should definitely be seeing that they're able to hold on to a crayon or marker and put a mark on a paper. It may not be very specific, but definitely willing to put a mark on paper. As we move into the next year of development, as you can see from a receptive standpoint, things are starting to become much more specific. So understanding opposites. So if you think about it, we're talking about big versus little, soft versus hard, smooth versus rough. So these concepts are definitely becoming more of part of our language, and children are better able to understand it. They're following two-step directions. They're very quickly acquiring lots and lots and lots of new words. So, you know, from an expressive standpoint, at this point, they probably have a word for most of what they are involved in or engaged in throughout the course of a day. They're able to talk about items that are not immediately right there in front of them. They can talk about things that may be in the next room or talk about something that they were playing with in another location within the house. The sounds that they have now in their sound repertoire would be the k, g, d, definitely at the level of words. So as you can see, the sound repertoire it's expanding. So they should have the ability to be able to have relatively clear speech. At least people close to them should understand when the child is speaking what it is that they're saying. They're combining 2 to 3 words in a sentence to ask for things a little bit more specifically. They're starting to ask questions. They may be experimenting with sounds a little bit, so repeating things just to make sure that they make sense or they sound okay. And they're starting to use prepositions. So along with the expansion of language, it's becoming much more specific. So, you know, instead of mommy up, it may be mommy put apple up or mommy apple up. So we're starting to expand a little bit on that language and becoming much more specific. From a social perspective, they're starting to understand emotions. They can identify emotions that are happening for them, identify emotions happening with someone else. They're also showing lots of independence. They're starting to identify themselves by name. They're starting to use pronouns like I and me. They love playing with other children. They may have a special friend in class and have lots of concern for children their age. Cognitively, so in their play, children are also starting to match based on colors. identifying similarities and differences between different sizes, textures, but they're also able to match based on color and shape. They're starting to count. They're doing much more sophisticated play, so they may have a lot of that very elaborate pretend play, imitating what happens at a birthday party, or they're in the kitchen preparing a meal, and really paying, very particular detail to how mommy might do it or how daddy might do it when they're in the kitchen. They may remember details of different activities that have happened during the course of the day and want to talk about it. So, their memory is definitely becoming much more finite. They're able to share information about different sequences they may have during the course of the day, or they understand that before we go to have, breakfast, the first thing that we need to do before we have breakfast is to make sure that we wash our hands, and then we, sit down. Mommy puts on a bib. So there's all these different sequences and steps that they're actually starting to recall as part of their daily activities and routine, and they're making more of an effort to try to solve problems on their own or utilizing tools to help them solve problems. Physically, these are children who are definitely able to climb into a car seat, help with buckling the belt. If anything, they're insisting on helping with buckling that belt. They can walk independently, usually, very good with holding on to mommy or daddy's hand. Fine motor-wise, they're starting to draw in circles. They can start tearing pieces apart, gluing pieces on paper. They're able to pour from one cup to the other. So they're really using their hands really well and becoming much more sophisticated, starting to feed themselves pretty independently and doing it pretty nicely. 3 to 4 years of age, from a receptive standpoint, they're consistently responding to their name, so you can be in another room in the house, call out their name, and they'll probably come running. They're definitely better able to understand color words. So as you can see, the receptive vocabulary is becoming much more specific. They have labels for different shapes. They have titles for different family members. They know who these people are and are better able to identify them if you name them. From an expressive language standpoint, they're answering very simple questions: who, what, where. If you notice, these things are still relatively concrete, but they're starting to become a little bit more complicated. They're able to rhyme. So if you think about what kids are learning, they're starting to learn how to rhyme. It's a big part of music and different children's books. So they're playing around with sounds in that way, consistently using different pronouns: I, you, me, we, they. They have different plural forms, so you may start to notice, especially for just a simple plural, toys, birds, buses, not irregular. And most can understand by the end of this particular year of development, most can understand when the child is speaking. So not just people who are with him or her always. It's also people who may be new to their circle should be able to understand what they're saying. They're putting together four-word sentences. There may be some mistakes. So the example that's listed here is definitely for an irregular past tense form. Instead of I went to school, I goed to school. But that actually is pretty typical for kids this age. And they're talking about their activities and using multiple sentences at a time. So they may have been at school all day, but they're coming back and they're telling you what they did with their teacher and all the different activities that they may have done during the course of the day. And they're much more consistent with answering questions about what's happening in their day. So they're remembering these things. So again, cognitively becoming much more sophisticated. So by 5 years, we're definitely expecting to see children having a better understanding of first, next, last. So using that language, of course, when we talk about sequences and sequencing in the course of the day, they're understanding words for time, what's happening yesterday, today, tomorrow. They're following very complicated directions. they're able to also carry this over into the classroom, but using language that's much more descriptive. So circle something that jumps. So they're not going to circle the chair, of course, they're going to circle the frog. So they're starting to understand that different words can have different meanings and different levels of description. They're hearing and understanding most information. So in the home and at school, the take-home or takeaway is that they should be understanding all of these different directions. They should be able to understand what's being asked of them at school. From an expressive language perspective, they pretty much have all of the speech sounds at the level of words. The sounds that are listed here are sounds that tend to be a little bit more difficult because of the characteristics of the sound. So I'm sure we've all had children who have difficulty with the L. It may become a W. So for example, little becomes whittle. So that's something that definitely is occurring at this time in development, which is not uncommon, but for the most part, they should have these sounds. They're able to ask or respond to a question. If something is not clear, they will respond and clarify what's being asked of them. They're identifying letters and numbers. They don't necessarily need to repeat words and sounds if what they're saying it shouldn't be unclear. We should be able to understand what they're saying from the perspective of them being intelligible or clear, which is different than requesting clarification. Clarification is if what they're asking for doesn't necessarily make sense. If they're asking for something and they're not being specific enough, we can ask them to give us more information. Sentences tend to be much more complex, lots of action, and, you know, definitely providing more information or able to provide more information. They're able to engage in conversations, so a lot of that back and forth. So it's not just a couple of conversational turns where I speak and they respond. It usually can go back and forth and you can have lots of conversation about what's going on in their day. They're very mindful of their audience, so if they're speaking with children younger than them, they may actually change up their patterns to speak with a younger child as opposed to speaking louder if they're outside on the playground, which means that, yes, they do have the ability to monitor and change that behavior once they're inside. So in talking about all these areas of development, one of the things that I definitely want for you to keep in mind is that, first of all, and this probably should have been the first bullet, when we're talking about children's development and thinking about children's development, each child is unique and they develop in their own way. So it's very possible that by the end of a year, you may not see that they've achieved all of the milestones. They may have achieved, you know, more of one, less of the other. But when we are talking about the curve of development, what's considered to be normal, and I put that in quotes, is not normal for everyone. And I know as a parent, the hardest thing to do is not compare your child to someone else, but that's something to also keep in mind. The other piece is that it's very, very important for you as a parent to understand that not everything that a child learns in terms of their speech and language development is organic. We are actively providing them constant input and information and helping to shape a lot of those language skills, those speech skills, play skills. They're learning from us. So as a parent, it's definitely important to be very involved in how we're shaping these new types of behaviors. So when we think also back to what could be potential points of concern or things that could be potential red flags, obviously if there's areas that you're seeing where the child is not necessarily able to hit a lot of those bulleted points that we have for each area of development, that would definitely be something to, speak to your pediatrician about. The other piece is that at the very beginning of development, if we think about it and, we're looking to see if a child is actually localizing to sound. We need to be certain that the child's hearing is definitely not of concern. So if your child is one that has had a number of ear infections, if they're not consistent with responding to their name or different environmental sounds, that in and of itself can definitely be a huge red flag. So making sure to follow up with your pediatrician, having their hearing checked to make sure that the hearing is okay, because obviously that's going to be a huge piece with them hearing what's going on in their environment, as well as learning how to develop a lot of those sounds. If you do have concerns with the child's development, obviously starting with your pediatrician as a resource is the best thing. If you're finding that you are not necessarily happy about the conversation that you're having, you can also pursue having a private evaluation through someone like, or an organization like the hospital, where we do provide speech-language evaluations and treatment. If the child is also within that range of birth to 3 years, this could also be an avenue to explore is the early intervention system. So that's something that is offered. The initial evaluation is free. The services, it's dependent on income, but it can also be another really great resource for addressing needs and concerns. So just a few strategies to help with supporting speech-language development. I'm just going to highlight a couple of these. At all areas of development, reading is a huge, huge, huge support with helping to introduce language, for following directions, for labeling, establishing joint attention, encouraging conversation. So using books are really a wonderful way to really introduce language, and it's something that can definitely be tailored based on the child's age, what they're able to do, how they're able to participate. Simple things like talking about what you're doing as you go through the course of a day, narrating the steps that you need to take in order to complete different things that you're doing, who you're seeing, where you're going, why you're going there, making silly sounds, identifying, sounds that animals make, that cars make, using song, using music. Great way to introduce language, and it's also a great way to introduce movement. A lot of children learn through music, sound, movement. It's also a wonderful way to go back and forth, taking turns, rolling a ball back and forth, playing peekaboo. When we're doing these activities, establishing eye contact is key. So we're teaching the child a lot of social engagement that way. And it's also a wonderful way for them to actually watch your mouth, which is going to help them with shaping these sounds. Expanding on what we say, so going back to narrating, we can talk about what we're doing, but we can also expand and use different words to describe what we see and what we're doing. Using different types, and when I say sensory experiences, meaning using things that are wet, using things that have a little bit of grit, like sand, using Play-Doh, introducing those types of textures just to get a child accustomed to playing with these textures, using their hands, and really getting in and being dirty and having fun with those things. Helping them learn how to group items together. What are things that we can talk about that make items the same or different? Providing choices, encouraging pretend play, and then also counting out loud. We count everything, so it's easy to count toes, fingers, steps, jumps, hops. So lastly, I just wanted to quickly touch base on, use of electronic devices. I know that this is a little bit of a hot topic. There are those who say that, you know, and it's definitely concerning to spend too much time. I think when using these devices, I think they can be used responsibly, especially if we are thinking about establishing certain rules of how to best engage our child using these tools. Knowing when to introduce them, knowing when to stop, and, you know, thinking about how to do it as a cooperative activity. So not leaving the child to work with the application on their own, but using it as an opportunity to share this application with them so that they're taking away something from the task that they're looking at, that it's not just an opportunity to watch items move across the screen. So the American Academy of Pediatrics actually has provided some basic rules to think about in terms of really being able to manage use of these tools wisely. And Family Time with Apps is actually a little informational a sheet that we have that basically provides just some specific guidelines and recommendations for different applications that could be effective for use in the home, and having you think a little bit more critically about how these tools can be effective for you as a family. So I will make an attempt to make sure that I post this along with this talk, so that you have access to that information. So at this point, I thank you for your time and your attention, and I believe I will be attaching my contact information if you have any questions regarding the content of this particular talk. Please feel free to give us a call if you have any needs or concerns. We are always welcoming for different questions from the community, and are always available to provide any assistance if we can. And thank you again for your time. Have a good night.